Hey, good morning, everyone. Let's go ahead and get started. Just to remind those folks on the phone, if we've got you muted, but please hit *6 to unmute your line if you need to ask a question, and then *6 again, please, to mute yourself so we can minimize background noise. Thank you guys for making time to be here. We just wanted to give you an update on where we are this week. Just to remind you, we are at this moment, including in our eligible group of vaccine recipients, our Phase 1A, 1B populations, as well as all people over 65, starting in about 3 days on Monday, March 22nd. Eligibility is going to expand to include everyone in 1C, as well as all people 55 and older. Remember that 1C includes additional critical workers, also includes people with certain high-risk medical conditions, people with intellectual and developmental disabilities, and again, we are also going to add to that group people 55 and up. So for the other groups, the high-risk conditions, the IDDD population and critical workers, that's all adults. So that's 16 and up, as well as all adults 55 and up. We think that's going to more than double the number of eligible people in our state. Probably between half and 2/3 of all the adults in the state are going to be covered at that point. So that will be a significant increase in demand, we believe. At this point, our number of first doses we're expecting this next week is going to be between 110,000 and 120,000 doses. That's a slight increase in Moderna. It's a definite increase in the Pfizer vaccine we're getting. At this point, we still don't have any indication that we're getting Johnson & Johnson for the remainder of the month, as we said before. Although we said that a week ago, and we got about 5,000 doses the next day. So at this point, we don't have any indication that we're getting Johnson & Johnson until about April, which is when the rest of the country expects to see it. We had talked to you last week about county-level data. We've got asked about that a lot. We've had a team that's worked really very hard on getting that together. They've done a terrific job of trying to get that into a usable format for the public to see, and we actually wanted to show it to you today. I'm going to slide over to the side, and we're going to pull up the screen, so hopefully you can get a view of where we are. This is the same dashboard hub that we have had all along, and this is actually the screen where we've been showing vaccine numbers before, but it's been redesigned a little bit, hopefully to make it easier to use. Instead of showing the number of doses issued by week, we're adding them by day, as you can see there. There will be some cases like we've had with all of our data before, where numbers in the past are going to change a little bit as we get them reported to us. So people may give shots today, and we'll tomorrow report only on the doses we know, but if they wait 2 days to let us know about that, then the numbers in the past are going to change a little bit. But you can get some sense of where we are. You can see, for example, how things are a little slower on the weekends, less on Saturday and Sunday. You can kind of see where the ice storm was earlier in February, or the cold weather was, and so on. So there's a number of those kind of details that you can pick out. I wanted to show you, if you click on the % receiving vaccine, these tabs at the bottom are the first really county level data that we've had available for everybody to see. If you click on that tab, you can see the counties are sort of color coded, and you can either go to the right over here and pick a county, and it'll drop down and sort of show you local numbers, for the county there, the number of total doses administered, how many people have received one or more doses, how many people are fully vaccinated. Just if you did it randomly, show one. How about Montgomery? There we go. Or you can also click on the map itself and pull up some additional details on a county. So you can see, it'll show you the estimated population that we're trying to reach, the number of people who have received vaccine, and if you can scroll down on the little tab there, you can see 20% of the people are involved, have received a vaccine in that particular county. And Jamie, if you can take the slider bar there in the little box, there you go, and there's a little bit more information down there, I think. So 11% of the people have completed their series, and so on, total number of doses given. So hopefully that'll give people more information about what's going on in their particular county. When you show county level data, the first thing people want to do is compare how they're doing to somebody else, and we certainly understand that's a natural human tendency. We continue to allocate our vaccine as fairly and equitably as we can based on where the eligible populations are. I would say we are probably now at a point where we're going to determine how much vaccine hesitancy we have. At this point, we've had enough demand out there that it's hard to know if a county's not getting vaccinated, is that because they can't find vaccine, or is it because they don't want to take the vaccine? And I think we're going to soon have enough product available that we'll be able to make some determinations about that. We see that one thing we're actually proud to see is that the highest percent vaccinated counties in our state are in the black belt for the most part. Almost all of them are, and that's a deliberate effort on our part to try to make sure we reach those most vulnerable counties. I believe the top 9 counties in the state in terms of percent vaccinated are all black belt counties, and we continue to try to prioritize them. That, as you see, doesn't necessarily include all black belt counties. However, we still have some work to do, and that'll be part of the National Guard program that we'll talk about in just a minute. If I can ask you, Jamie, would you click on Vaccine Providers, the tab, and you can see the providers list we continue to update as we add new providers. And then the next tab is the federal pharmacies. We have, besides Walmart and CVS, we now have Walgreens with products in about, let's see what the number is, about 50 locations, I think. They're green because they're Walgreens, so easy to pick out on the map. And we'll continue to update those as we get more people who come on board. I do want to show you, can you click on the demographics tab there as well? And I don't know if that's going to load or not. Well, let's see if it'll reload. Okay, well, we can, yeah, you have to update your browser sometimes to see that. I'll just mention a couple of items from that because I can't show it to you easily right this minute. We have now vaccinated around a little more than 15% of our vaccine has gone to African Americans in our state. That number is increasing, and we're glad to see that, although it's still below where we would like to get. Remember, Black Alabamians comprise about 26-27% of our state, and so we want to continue working on that number. At the moment, about 54.4% has gone to white people in Alabama. We still have about 28% that's unknown or not reported, and so we're working to try to fill in those gaps. Let's see. We were very pleased to see earlier this week the CDC had a publication in the MMWR. We reported it to the public yesterday, and you may have seen this, but the MMWR looked at all states in the country and how well they were doing in terms of equity goals. They looked at most vulnerable counties in the state, in each state, and how well states were doing in terms of reaching people in their most vulnerable counties. Alabama actually ranked 9th in the country in being successful at reaching its most vulnerable populations. We're very proud of that, and again, I would say that's not an accident. That's a very deliberate strategy on our part to try to reach the people who are most vulnerable, and so we would encourage you to take a look at that. We will continue to work on improving that, though, because we certainly want to remember who's most at risk from COVID-19. Just a few other numbers for you. You saw, I think, on the screen that we'd given about 1.3 million shots so far. I think I just now got an updated number on that to share with you. As of the dashboard will be updated shortly, but as of last night, we are at 1,381,699 shots. That's 1,381,699. The number of people receiving one or more doses is 877,815, 877,815. The number of people who've completed their vaccine series is 529,402, 529,402. So we are doing a very good job with that. We now have a total of 1,265 providers that are enrolled around the state. Not all of those have received vaccines so far, but at this point we have about 355 sites that have received Moderna, another 58 who've received Pfizer, and based on the limited amount of J&J we have, we've still reached 141 new providers with J&J vaccine, and virtually all those were providers that had not previously received vaccine. Let's see. All right. When we expand our eligibility next week, I think there's going to be certainly some increased demand. The National Guard has been great partners, and it has worked very hard to plan on rolling out their clinic starting next week. I want to clarify something that I saw reported incorrectly. The National Guard clinics start on Tuesday. The eligibility expands Monday, but the actual shots will start being given on Tuesday of next week, the 23rd. The plan for the Guard is to give shots 4 days per week, Tuesday, Wednesday, Thursday, Friday, each week. They will move from one county to the next day after day, and then after 3 weeks we'll start over to go back to give second shots because they're using Pfizer vaccine, so it'll be a 3-week interval. There are actually 2 total teams doing that, so that allows us to cover 24 counties. We'll cover 24 counties over 3 weeks and then go back and start those same 24 counties again after 3 weeks. The Guard teams actually are going to turn out to have about 85 soldiers in each team. We have published the sites of these clinics, and that's available on our website. I want to emphasize that there is the chance that these sites can change depending on what weather occurs, depending on just local conditions at the site, depending on a lot of logistical things. So even though we do have this list out there, and we would encourage you to circulate that, please notice the disclaimer at the bottom which says check the link to make sure the sites haven't changed. So that's really important for people. We would really hate for somebody to save this list that has a clinic 3 weeks from now and then the clinic not actually be in that site when they show up. So please check our link on the website because these can and probably will change in a few cases. We have, again, prioritized our highest SVI counties. These are the sites that we want to get to. These are, generally speaking, in the Black Belt and in the wiregrass areas. And so this is a big part of how we get at vaccine equity. As you know, many folks in the country are talking about opening eligibility to all adults, period. There are 2 states that have done that already, Mississippi and Alaska, but there are a number of other states that have announced that they are about to do that. There's some this coming week. There's several that have announced by April 1st they'll open to all adults. The President asked all states to open eligibility fully by May the 1st. Certainly Alabama will do that by May the 1st, but it could be much earlier depending on how much uptake we see. I say that in the context of talking about these clinics. This current schedule for National Guard clinics is going to take 6 weeks to complete. It's 3 weeks around the first time and then 3 weeks again the second time. There's a really very good chance that eligibility is going to be expanded before we get done even with this first rotation. So that, again, is going to require some flexibility on our part as well as the part of the public in understanding how that's going to work. But we will let you know more about that. I think as we see what uptake is going to be the next 2 or 3 weeks, we'll be able to make a decision about when to expand further. Just a couple of other things. We now have about 99 variant strain cases that we have identified in the state. Almost all of those are the UK variant and the B1 variant, but we have identified a handful of cases of the California variants that you've probably read about. To the best of our knowledge, the current vaccine products do protect against those California variants. So we, again, are doing our best to get vaccines in arms as quickly as possible to make sure we stay ahead of any new infections, any new strains that may be spreading. Remember that the mask mandate will end on April the 9th. That's when the current health order expires. As we've said many times before, there's nothing magic about April the 9th. That's not a day to stop ignoring the guidance about how to protect yourself and to protect others. I think it's very likely that we will all continue to encourage people to wear a face mask after that time. In public health, we have told our staff that the rules will stay the same as they are now in terms of wearing masks for our staff, for employees. I know a number of businesses and healthcare facilities and other institutions have also announced plans to do that. I want to point out in particular, hospitals and nursing homes are under federal guidance to wear masks, and so I think it's very likely that nursing homes and hospitals will continue to follow that federal guidance, and I'm sure they will, and will require masks, I think in most cases, including of visitors. So it's important for the public to understand that I think we worry that on April 9th, suddenly people will show up at the hospital and be incensed that they're asked to wear a mask, and they absolutely need to expect to be asked to wear a mask, because there's good science behind that, but there's also federal guidance that says that people should do that. So we hope the public can understand that and cooperate with those healthcare facilities that are just trying to protect their patients and their staff. We had some inclement weather, as you know, earlier this week. Fortunately, the state came out perhaps better than we had worried about. Fortunately, we did have some county health department closures for a day on Wednesday. We did not lose any vaccine as a result of that. We didn't have any power problems or refrigeration problems that lost vaccine. We did have to reschedule patients. All those patients are going to be rescheduled either for this week or for next week, so we don't believe that'll cause any significant delays there. And I believe that's all I had to talk about, but I'll be very happy to answer any questions.
Yeah. There's been a number of vaccine providers in the Dothan area reaching out this past weekend, saying that they're trying to promote getting the vaccine. People are just not signing up, is what I'm hearing from over there. Why do you think this is? What can be done to help?
Yeah, I think there's got to be more than one reason. It's hard to know. I actually took a trip to Dothan last week on Friday, I think it was a week ago. Representative Paul Lee had asked me to come down and see the site at Southeast Health in Dothan. That hospital's doing a terrific job, by the way. That's a real model for how clinics ought to be run. I think that we are just now beginning to run up against vaccine hesitancy a little bit. As we've talked about before, we haven't really been able to measure that well because we don't, when we have not enough to go around, it's hard to know if people are staying away on purpose. The polling that we've done that I mentioned to you last week shows that there's about a third of Alabamians or so, both black and white, who are real skeptical about taking the vaccine, and maybe for different reasons. But we know that there's a segment of the population that's just not making that a priority for them. So we continue to try to work on that. We continue to publicize that there is vaccine. I think as it becomes more normalized and more people see more people getting it, that'll overcome some of the hesitancy. Hopefully we can educate people who are just who just don't have enough medical information to know whether they need the vaccine or not. And then also we absolutely want to work on any kind of mistrust issues about people who are just suspicious or don't believe the facts around the vaccine and so on. So there's a lot of different reasons.
Dr. Harris,
yeah.
We've seen an uptick in the number of cases in about 10 states. Obviously, the governor said the mask mandate won't go past April 9th. You've talked about personal responsibility she has as well. Are you worried as we get into these next 3 weeks about Alabama's numbers really picking back up even though we're getting more vaccine?
Yeah, I would say I'm not worried so much as to say that we're just aware and monitoring it, and certainly would be concerned if we see that. We haven't seen it yet. I think that it could happen as we get more variants that are easier to transmit. I think more cases could result from that. But at the moment we're not seeing signs of that. I think we're doing what we need to do, which is right now we're still continuing to encourage people to wear masks, to stay out of groups, to stay home if you can, and to get vaccinated. And that's really the most we can do. And so we'll continue to emphasize those same things. Yeah.
Dr. Harris,
Yeah, go ahead on the phone.
Yeah, this is Brendan Kirby from Fox News in Mobile. On the hesitancy issue, you mentioned the polling you've done. Is that something you could release that to us so we can see the details of the data? And then the question being, have you been able to pinpoint how much of the hesitancy is people who are just sort of reluctant and kind of waiting to see how things go, as opposed to people who are just sort of hardcore no's that are not persuadable.
Yeah, just 1 second on that. Do you know when we're going to have that available?
I'll check with them.
Okay. Yeah. At some point, we definitely will release it. We haven't done it simply because it is new and new data to us, and we're still going through it. We've only had it about a week, a little over a week or so, but we will make that available when we're able to do that. I don't have percentages that I can remember or tell you about the different types of hesitancy, but clearly that comes in many different flavors. And you have people who are just hardcore anti-vaxxers that you're never going to reach. You have people who are mistrustful of the government and who don't believe this. Maybe this is a real thing, or don't believe the reasons that we're having a vaccination program. But I think it's important to point out you have a lot of people who just have really good, normal, smart questions about a vaccine and whether it's right for them or not, or even whether it's safe, but they just don't have access to medical expertise to help them answer those questions. If you're a more affluent person and you've had a family doctor for 25 years and you can call them on the phone and ask them, is this vaccine for me, then your hesitancy might vanish overnight. But if you're somebody without access to care, if you don't have a normal provider relationship, or maybe you just don't have a good medical literacy yourself, it becomes really hard to answer those questions, even though those are very normal questions that people ought to be asking. So I don't know what the percentages are, but hesitancy comes in a whole lot of different strains. So good. Yeah.
Yeah, Dr. Harris, you just said that it's very possible we could open up to all Alabamians or adults before May 1st. What are the key indicators that you're looking for before you decide to make that decision?
I think clearly the most important one is what's our available supply. If everybody's prioritized, then essentially nobody's prioritized. And then if you don't have enough vaccine to go around, then it just becomes, a mad rush, to beat everybody else to the front of the line. So we still want to make sure that we're vaccinating the people who have the most risk. That's been our strategy all along. We want the people who are most at risk for serious illness, or the people who are most at risk for exposure and becoming infected just because of their job or social situation or living situation. So those people are the ones we want to get to first. At this point, we will, as of Monday, have open eligibility to all those risk groups that we've stratified. And if there's a lot of demand and the lines are miles long and there's no doses on the shelf, it wouldn't make sense to expand it to everyone yet. But when we see that demand's not there is when we'll expand it. So uptake is the single answer to the question.
Dr. Harris,
yeah.
With Plastics in Birmingham. A couple weeks ago, I asked you about the FEMA programs of mass vaccination sites in Alabama. Can you give an update on the status of that?
Sure. Up until this point, we have not been eligible for those. FEMA announced these pilot community vaccination centers that we're only going to go to counties that had at least 1 million residents. Was the cutoff they used, and so they showed up in about, I think, I can't remember, 10 or 12 states. Maybe that number is a little higher, 12 or 15 states. We have actually heard in the last couple of days that it's possible Alabama might be offered one. We don't have full details on that yet, and we're not sure how that's going to work. Some of the FEMA efforts have included supplying staff, but not vaccine, and that's clearly not something that we're likely to take up right now, just because without additional vaccine it doesn't make sense. If we have an offer to bring staff as well as federal vaccine, then that's obviously something that the governor would consider, or that we would consider doing. I do know from talking to other states, some of the states that have had these community vaccination centers, you say that they're really resource intensive. So the feds bring vaccine and people to give shots, but every other thing falls on the state, including all the administrative support and IT support and traffic control and security and sites and lots of other things. And so they are fairly resource intensive on the state, even when they come with a vaccine. But certainly, if we have an offer to do that, we're going to seriously look at that.
With the mask mandate rolling back on April 9th, I took the issue that you guided to restaurants or other businesses especially restaurants and bars, who no longer have the mask mandates have been enforced?
I'm really sorry. I'm kind of losing you. Could you speak up a little bit, please?
Oh, no problem. So with the mask mandate rolling back, have you issued any guidance to businesses, especially restaurants and bars, who are no longer relying on that guidance from the state, now they'll be responsible for mandating that themselves? Have you issued any guidance to them on how to navigate that?
See, just one second.
Guidance for restaurants and businesses after the 9th.
Oh, okay. Yeah, thank you. So I'm sorry, there was just a little difficulty hearing you, but the question, I think, is about guidance for restaurant and bars after the current health order expires. I think, just like every health order, I think we're going to wait and see what the situation is when that determination is made. When the current health order expires, I mean, ultimately, it'll be a discussion with the governor over how that office would like to proceed. But it doesn't mean that there will be no health orders after the 9th. It's just the mask mandate expires on the 9th, and whether there are a continuation of other health orders or not is just something we'll have to decide at that time. I think that as long as we have disease circulating, there's still a lot of things that make sense for restaurants to do, even if they're not mandated by the state, including how many people you pack in together for how long and so on. But that's a determination we'll make as we get closer to that date. Yeah.
Dr. Harris, you've said in the past that there is some vaccine hesitancy among minority communities for reasons that date back to the Tuskegee experiments and everything. At the same time, there's been national polling in recent days that shows some of the highest vaccine hesitancy is among specifically men who identify as very conservative Republicans. And it strikes me that those would be sort of disparate communities to try and communicate to. Is there going to be separate strategies from ADPH for different pockets of hesitancy, or are you going with one central message?
No. I mean, clearly we have to address each one of these differently. There's not one size fits all communication strategy that works for all the different groups. And as I was saying a minute ago, some people are mistrustful of the government in general. Some people are mistrustful of public health in the state of Alabama specifically because of what you alluded to. Some people just don't have good information and they're not hesitant, but we still have to communicate to them the same way to try to answer these very legitimate questions they have about the safety and effectiveness of the vaccine. That there are, it's not a monolithic group of people who are hesitancy. It's dozens of different reasons, and so we're trying to think through them and trying to communicate to each group, with the tools that we have to answer those people where they are. You certainly just can't have one message to overcome that.
We've seen reports from some national media news outlets that have said Alabama has seen a 50 to 90% rise in cases over the last few weeks, or over the last week. Can you address that?
I hadn't seen the number that high. I think we've had a day or two where we've had an uptick, but we are still trending the right way. I think over the past 2 weeks, our case numbers, on average over the past 2 weeks, continue to slope down. Our daily new case numbers are having averages about as well as we've seen since all this began, back in April, March and April. So, again, we're not naive about that. They may go up. States around us have seen some increases. I think Tennessee and Mississippi have seen some bumps recently. We have not seen it yet, and we hope we don't, but obviously that could change.
Dr. Harris, look at the guidance that came from Washington as far as having all adults that are eligible to open up. What could you tell us about the amount of vaccine that will be coming in when we get to that date, May 1st, that President Biden put out there?
Yeah, it's hard to know for sure. What we think, by May 1st, we think sometime in April we'll have a reliable supply of J&J, although we don't know quite how much that'll be. The original goals from that company were to get 100 million doses by June 1st. They've now partnered with Merck to add additional manufacturing capacity, so I don't know if that changes that timeline, but I imagine it probably does. So we hope that we'll have an increased product, or more of a new product. We've been seeing increases in Moderna by a couple of % a week, and Pfizer a little bit more than that, but they have both increased a little bit every week, so we hope that will continue. I'll tell you, when the president spoke the first of last week, he said he hopes states will open eligibility by May 1st, and that there should be enough vaccine by everyone by the end of May. Now, that's how he put it. So it doesn't sound like we're going to have enough for everyone by May 1st. But again, you know, relative to the previous question we had, it's all about uptake. If we have a lot of hesitancy and people aren't coming to get shots, then we'll have enough. We'll just be trying to convince people to take it.
Dr. Harris, just a technical question on the numbers that you released yesterday on the vaccinations by county. Does this look at a residency? So if a resident of one county got a shot in another county, you know, it would correspond to the county that person lives in. And does it also include people who have been vaccinated through the federal pharmacy program?
Yeah, sure. That's a great question. So we track these numbers by different ways. We track them by where the provider's located, and we track them by where the person who receives the vaccine resides. And in the case of the MAP numbers that you see, this is based on the location of residency of the person who received the shot. So it doesn't mean they received it necessarily in that county. It just means they're a resident of that county and they received a shot in Alabama that we have a record of. It does include all people who receive shots from the federal programs as well as state programs. All shots are to go into our state's immunization information system, which we call Imprint. And so anything that goes into Imprint, whoever the provider is or wherever the source of their allocation is, that'll be reflected on the map by county of residence of the recipient.
And also people who go out of state for a shot. If someone, say, in Mobile went to Mississippi and got a shot, would that be traded from state to state?
We'll find out, but not to my
Yeah,
knowledge.
we'll try to make sure on this answer, but to our knowledge, that information is not shared state to state in most cases, so probably not.
Dr. Harris, this is Morgan with Fox 6. I want to ask you about vaccine waste. And I know that ADPH has said that there's no reports of people not getting vaccines, but there are some states that have said, that have asked the FDA to be able to do vaccine pooling, which I know that you know is common in other types of medications. Would Alabama consider asking the FDA to lift, to allow that for the COVID vaccines to stretch the supply?
No, I don't think we're going to independently request that. I mean, clearly, if there's more evidence that that's a really good idea, then by all means we would do that. But to this point, wastage has not been a big issue for us. We've had some doses that have been wasted, but they're typically very small numbers, and most of the ones we've had have not truly been wasted. But for example, I know we've had a couple of incidents where there were just problems with the syringe used and the dose got lost before it could be injected into someone or so on. So it's really kind of a 1 or 2 dose situation here and there. So at this point, that's not something we would pursue. There's a real definite infection risk in taking many different vials and trying to take doses from several of them to combine them to give to a single person. Each time you access a vial, there's a slight infection risk, and when you are taking product from multiple vials all at once, then that risk increases as you would expect. So until that becomes sort of a standard practice that national public health authorities recommend, we're not going to pursue that.
And Dr. Harris, just quickly, because there's other states that have reported getting, losing thousands of doses, hundreds of doses. And when you say Alabama, there's few cases of it happening. I mean, that seems like there's a conscious effort to make sure it doesn't happen in this state. And comparatively, that's pretty good.
We're pleased with that. I mean, I suppose there can be things we don't know about, but I don't think so. The last time I saw a number, it was in the neighborhood of maybe 100 doses total, and there were, there were lots of reasons for that. There were some cases where You know, we have a vial now we're supposed to be able to pull 6 doses out of, but we're only able to get 5, and that, you know, technically looks like a lost dose. I mean, I guess it is, but, you know, it's not that there was an error made there. You know, there have been some cases we know of just a syringe failure where, you know, the dose was drawn up and the syringe wasn't functioning correctly. So they've been very small numbers so far. We're very happy about that.
Dr. Harris, it's Miranda Fulmer with WVHM in Birmingham. Can you go back and talk a little bit more about the variant here in Alabama? And is the state anticipating a possibility of more variants with spring break and full swing and continuing throughout the month? Can you talk a little bit more about that?
Sure. I mean, all viruses mutate, and there's no question we're going to have more variants the longer we go on with this. That's just inevitable. Most of the variants that we know about are not variants that put people at higher risk for serious illness or higher risk for death, even though they may be at somewhat higher risk of being transmissible. But we'll certainly continue to see those. The more people that you have mixed together in an unsafe situation, the more disease transmission you're going to get, and the more opportunity for a variant to occur. You know, if you're infected with a virus and the virus begins to mutate, that's only a problem if you give it to someone else. And so that's why we would encourage people to continue to follow all the guidance that we've asked them to follow. I think the issues that people are suspecting about the variants, and we don't know for sure, is that it may be that the monoclonal antibody treatments that we have aren't as effective because those were designed around wild-type virus, and as you get new variants, it's certainly possible they're not going to be quite as effective. Obviously, that same logic applies to the vaccines. To this point, the B1, the UK variant we have, and the California strains that we've just seen a couple of cases of are thought to be covered by our current vaccine product. So, but you know, there's always a chance that we could see something in the future that's not.
Dr. Harris, this is Morgan with Fox 6. Just one last question for you. Do you have an estimate of how much money the state's going to be getting from the latest stimulus, the stimulus bill, to be able to further vaccinations here?
Do you know that?
Not yet.
Morgan, I don't know. I'm not sure if we know, but if we know, we'll get that information to you. I just don't have that, and I'm not aware of a number.
And just to clarify, the vaccine registries, they don't communicate.
Okay, and to clarify a question that someone asked earlier, the state vaccine registries actually do not communicate, so we don't have information on Alabamians who are going to other states. Thanks, Ron. Okay. Anybody have anything else? Okay. Well, listen, thank you guys for being here. We appreciate it, and we'll talk next week.